The question of how to spend millions of dollars is on the minds of a lot of community leaders in Maine. According to the Maine Monitor, the state is expected to receive $230 million in settlement funds through 2038.
This money comes from settlements with major retailers and pharmaceutical companies for their roles in the opioid crisis. So the money is being distributed three different ways. 50% goes to the Maine Recovery Council, 20% goes to the state, 30% goes to eligible counties, cities, and towns. The Maine Monitor reports some communities have used the money for mental health services, substance use treatment, and much more. Bangor is expected to receive more than $3 million and has received about $1 million so far. And the City Council recently created an advisory committee to decide how that money will be used. News Center Maine's Brianna Bush has our update.
Being able to have solutions that meet people where they're at is going to be one of the most important things.
The city of Bangor is working to find those solutions through the nearly $3.5 million it's receiving in opioid settlement funds.
What we need to be able to do is to continue to lean into exploring and to be really creative about how we're designing and implementing those solutions.
Some of the funds are currently being used to support a syringe cleanup program led by Wabanaki Public Health and Wellness. The city voted last month to establish an opioid settlement funds advisory committee. It will be made up of people who have experienced substance use disorder and other leaders experienced in providing recovery services to advise the city of how to address the crisis.
You just don't really know a lot about the solutions and what the people are going through and what they've dealt with unless you've been in that situation yourself.
While the city determines how the rest of the funds will be distributed, organizations like Bangor Area Recovery Network hope they can be used to expand recovery services like long-term treatment and housing.
Having more sober living programs or rehabs or treatment services where people can go for an extended period of time would be really nice.
This opioid crisis has affected everyone in our community.
That's why Interim Executive Director of Together Place Peer Room Recovery Center, Joseph Hartel, says it's crucial for the funds to support resources like workforce development, training opportunities, prevention efforts, and harm reduction.
And when we address those gaps, we're going to create a strong continuum and we'll have folks be able to break the cycle of addiction.
The City Council will make a vote to determine who will serve on the Opioid Settlement Funds Advisory Committee at Wednesday night's meeting. In Bangor, Brianna Bush, News Center, Maine.